Headaches are something we all experience in our day-to-day life. Understanding the type of headache you are undergoing is very essential so that you can undergo the right treatment. Headaches are classified into two types, the primary and the secondary. Primary in itself is a condition, whereas secondary occurs due to an underlying condition. Primary headaches are classified as migraine, tension headaches, and even cluster type of headaches. Now let's talk about tension type headache. Patient usually complains of a band-like pressure around the head. It's a dull, aching pain that's usually present on the bilateral side of the head. It's the most common type of headache. There is no associated symptom, but sometimes there might be an associated symptom such as the pain radiating to the scalp, neck, and even the shoulders. The triggering factors that cause the tension type headache may be stress, hormonal change, and even dehydration. Another most common type of headache is a migraine headache. It's a throbbing, pulsating pain. It's usually unilateral and the duration, whereas in tension headache is variable, but in migraine it is 4 to 72 hours. One of the main things to be kept in mind is that in migraine, symptoms are crescendo pattern, that is, intensity of the pain increases gradually over time. Remember, migraine is a recurrent headache. The associated symptoms in migraine are the nausea, vomiting, photophobia, and phonophobia. Now we are going to talk about cluster headaches. The other name of cluster headache, it's also called as suicidal headaches. Because of its stabbing pain, it's usually unilateral and associated symptoms are teary eye, rhinorrhea, sweating, and restlessness. It's usually unilateral and remember it's cyclic in timing. Like if you have headache at 4 p.m. today evening, you're again going to have the headache tomorrow at the same time. The duration is less than 4 hours. Now let's talk about sinusitis. Sinuses are space that are spread behind your nose, forehead and the upper cheek. When these areas are infected, it leads to sinusitis. It's a dull aching pain. Symptoms worsen when a person bends down. Then it is also accompanied by sneezing and yellowish nasal discharge. All these headaches can be treated with OTC drugs, anti-inflammatory drugs, calcium channel blockers, oxygen therapy, and even antibiotics in case of bacterial infection. Avoid stress, be hydrated, and avoid alcohol. And remember, if these headaches interfere in a daily lifestyle, consult a neurologist for sure. If you like this video, don't forget to give a thumbs up.